So today we're going to be doing a hip abduction MMT with Taylor here. So what we're going to be testing today is your hip abductors, so your glute med and your glute min. So what I'm going to have you do first is we're going to roll over onto your left side. Okay, and then from this position, I'm gonna have her bend her knee and her hip of the leg that we're not testing. And the first thing I want you to do, Taylor, is just try to lift your leg up as high as possible. Good, and then back down. Good. So she's able to go through the full range of motion there, so that gets a 3 for her. So now I'm just gonna stabilize at her hips. Go ahead and go through that range of motion again. And then I'm gonna apply a force straight down here. Don't let me push you down, okay?
Okay.
Ready? And relax. Okay, and then she was able to resist against moderate pressure, so that would give her a 4, and then she was also able to resist against max pressure, which would give her a 5. And then if she couldn't do either of those, we'd go to a gravity minimized position. So I'm gonna have you roll onto your back. And then we just put a pillowcase or a blanket under her feet to reduce the friction. And then from this position, I'm just gonna have you bring your leg out to the side as much as you can, and then back in. Good. And then she was able to go through that full range of motion, so that would get her a 2. And then a 1, I would be able to feel her glute med and glute min contracting, but there wouldn't be any movements. And then a 0 would be no muscle contraction at all. And then your hip abductors are innervated by your superior gluteal nerve, which is your L4, L5, and S1. So that's what we would be testing. She was doing the test, some contraindications that would let me know that her abductors are weak would be if she tried to laterally flex to get that leg up, or if she was pushing through her elbow onto the table to get the leg up. Today we're going to be testing Taylor's sub-talar joint range of motion. We're going to be testing eversion today, so what I'm going to have you do is lay on your stomach. Okay, so what we're going to do is for our landmarks, our axis of rotation is going to be at her posterior talocrural joint. And then our stationary arm is going to be in the midline of her posterior gastroc. And then our movement arm is going to be in the midline of her calcaneus. So whenever you're ready, Taylor, go ahead and evert. Bring your foot further out to your right. Good. And relax. And I've got you at 6 degrees of eversion. So normal is about 5 to 10 degrees, so you're within normal limits. But if there was anything limiting that motion, her deltoid could limit her eversion, as well as the approximations of the bony landmarks within her ankle.